following events were recorded as they happened at the Hospital for Sick Children in Toronto. In this episode of Life's Little Miracles, Alyssa's eye operation, Edgar's lung mass, David's cut head, and Jacob's third open heart surgery.
His procedure this time, the third time around, is going to be a little more difficult.
"21-month-old Jacob Swan was born with an underdeveloped left heart that is unable to carry out its job of maintaining circulation through the body.
Maybe I'll try to put the stickers on while he's waiting there. These little blue stickers.
Jacob's heart will never work properly, but surgeons are hoping to ease the workload of the malformed heart by rerouting normal blood circulation with an artificial shunt. Jacob has already survived the first two parts of the three-part operation. The final stage of surgery will mean a radical change in his circulation. Not every patient can tolerate this, but without it, Jacob will not survive childhood.
Good boy. Here comes our picture. Yeah, all done. So once you get all those off, you can go back to the waiting room and you'll see the nurse next.
I was 6 months pregnant. We were in Sault Ste. Marie. And we thought maybe there was something because they were taking a really long time with the ultrasound, like about an hour, and they couldn't get a good picture of the heart. So we didn't think anything of it at the time, except maybe it's a heart murmur or something like that. And we were going to go through with a midwife, and she phoned us at home, and she told us that she wouldn't be delivering the baby. And she said we will be going down to Toronto, and he'll require heart surgery.
Today, Jacob has final appointments before undergoing surgery in the morning.
His babysitter gave us these. She goes, take these when he gets blood work.
Is it helping?
I don't know, we haven't tried it
Is it
yet.
for Mommy or for JP? You both? Okay, let's type down on your arm. Actually, let me see this one's closer to you. Pumpkins. Look at all the pumpkins, see? See the little pumpkins? Pumpkin. Good boy, sweetie. Almost finished.
I hope you're holding them tight.
I am, yes.
That was good. You didn't even hardly notice.
I know. Wait, I can send myself. Okay, boo. Just gonna press real hard. Good. Okay, Jake. Oh, jump in.
Okay, there you go. Run loose.
We'll walk around there, buddy. That wasn't bad.
Oh, you just press that
Mommy,
on.
you go on. Oh.
4-month-old Alyssa was delivered at 24 weeks with an eye disease called retinopathy of prematurity. Abnormal tissue growth and scarring are causing the inner lining, or retinas, to detach from the outer lining of her eyes, and Alyssa will be blind if the process cannot be stopped. Today, doctors will attempt to remove the scar tissue in her right eye in the hope that Alyssa's retina can fall back into place.
We're ready. Let's go see Dr. Lam. I love you, Bunny.
The operation does not have a high success rate, but it is Alyssa's only chance for even partial vision.
Okay. Let's roll. You will need to give me a hand. Yeah.
This surgery will be very similar to the one that we have done last week. That's right, for last week. And it's the same thing essentially. We take out the scar tissue that's formed. And the danger of this is that the scar will keep pulling on the retina until the retina detached partially and then totally detached. Yeah. The surgery is to stop the tractions on the retina. This is going to be a little bit more difficult because there's more scar. So
this should take longer today then?
It probably take, yeah, it will probably take another extra half hour at least.
Okay, just so we're prepared.
Yeah.
Just comfortable. Okay.
you're scared.
Don't worry, you'll be okay.
Jacob must be examined by the anaesthetist, who, in addition to putting him to sleep, will be responsible for keeping him alive during his surgery.
Jacob, I'm just going to listen for a second, all right? And then I'm going to talk to Mummy and Daddy. Stand here for two seconds. Can we do 2 seconds? 2 seconds. I just want to listen for 2 seconds. Oh, Dolly do. Okay.
What's the matter?
I'm nearly done. I'm so nearly done.
Here.
Oh, not that again. All right, off you go. I can't stand it, and neither can you. There we go. What we will do with your boy is give him some medicine tomorrow morning called midazolam. And all it does is it makes them daft. It makes them slightly drowsy. The procedure itself is probably about 5 to 6 hours. And as previously, he'll be with the fairies, out for the count, fast asleep, within about 5 minutes of parting company with you guys. The issues that we have as far as looking after a child having a third time surgery are predominantly bleeding is a problem in any child that's had repeat surgery. So it is likely he will be transfused tomorrow. This should be fairly straightforward, which is not to minimize, you know.
Right.
It's a big deal.
The OR team is ready for Alyssa.
Let's go. You're gonna go, okay? I love you, big good girl. You show them what you can do in there, okay?
Take the baby, I'll take the IV.
Love you, baby. Cindy has the chart.
Here's the chart.
Okay, see ya. I'm gonna be inside and Mom's gonna be strong for you, okay?
Do you know where the waiting area is?
Yeah.
Oh, okay.
Yeah.
This way.
And we'll
Okay.
just leave this right there, because that's
All righty.
Just keep that warm.
Let's go.
Take care of her. Thank you.
Doctors must remove the scar tissue that is causing Alyssa's retina to detach.
With the flat lens, please. Thank you. So that big blur of white tissues is organized vitreous with scar tissues there. And what I'm doing here now is to kind of shave that down to the back. It's a slow, tedious process.
Oh boy. Computer!
Jacob's operation is reviewed one last time.
So Jacob tomorrow is having the Fontaine operation. So that's the third stage of his Norwood palliation, okay? Now what we're gonna do in the operating room tomorrow, we're gonna open his breastbone, we're gonna dissect his heart, expose his heart. His procedure this time, the third time around, is gonna be a little more difficult because there is a lot of adhesions and scarring tissue inside. We are going to place a conduit outside his heart that's going to pretty much drain the blood from his lower body directly to his lungs. So it's going to bypass his heart completely because he has only one ventricle.
And so his heart is working harder than our heart. Would that be right or no?
It's not working harder than our heart, but right now his heart is working a little harder than it's going to be after the Fontaine because
Right.
less blood is going to be drained directly into his heart. So that theoretically is going to increase the chance for his heart to last longer because we are unloading the heart. What we do is we get a big piece of it's a Gore-Tex tube or a plastic tube, and we just connect it these two vessels here on the side of the heart. So now the blood from the lower body is also going to drain through this tube, go up, and then go through the lungs. So the risk of passing away from this operation would be about 4 or 5 in 100. Okay, and so I'm going to give you the consent form for you to sign.
Jacob will return for open heart surgery in the morning. Six-year-old David fell while climbing up to his ceiling fan and needs staples to close the wound.
And I piled stuff on top of my stool. And after that, I just banged my head right on the bar of my bed.
Oh no. And did you cry or anything?
Yes.
Yes? And then what happened?
And then my mom, I went to bed because I thought I was in trouble.
Yes.
But once I noticed there was blood there, we had to go to the hospital.
Oh, and get your head fixed. So where's your cut? So Dad, if you could just hold it right there and just press on it and it'll work faster. How's that?
Good. They have to hold this gel on my cut for 20 minutes because...
Well, so it helps to freeze it.
Yeah, it helps to make you go to sleep.
That's right. So you won't feel it so much when he's putting the stuff on you, right?
Yeah. And Mom, you better change the pillowcase and watch the other one.
I will. Don't worry. We'll give you a clean one tonight.
What else did he put on top of the stool?
Well, he put his pillow, then he stacked a bunch of books.
He had a stool or something.
Well, the stool was
he had
there.
the red blanket over it. Red towel.
The towel, yes, his towel from the bath. So he's tied that all on top of the stool to get up to the stupid switch or the fan.
He never made it though.
And this one sees him doing it. And then, of course, this is the time she never blabs on him. When it's a good time to blab, you don't blab.
Well, Mom, at least Kitty didn't blab this time.
She should have this time.
Yeah, she should have blabbed, but no.
Alyssa's parents wait for news from the operating room. The scar tissue has been removed, but Alyssa's retina continues to pull away from the outer lining of her eye.
Because I couldn't get rid of the peripheral traction, so I'm going to try to put a band around the eye, a silicone band around the eye. What it does is it will squeeze the peripheral part of the retina in, and I think that will be the only chance. What this will do, it will push the edges of the retina in.
Once the silicone band is in place, doctors can close and the surgery will be complete.
Surgery is done. As you can tell, it took long and much longer than the last surgery. And the main reason is the scar tissue that form, that covers the retina, actually hold the retina up very taut. And so after I done the dissections, try to remove those membranes, at the end, when I clear up most of the membrane that I can identify, the retina still wouldn't fall back. And so what I did in addition, I put a band around the eye, a silicone band, and I'm hoping that that will relieve the tractions, the pulling forces of that scar tissues on the retina, so that the retina have a chance to fall back. We're only at the beginning of the battle, so we still have to wait and see what's going to happen. So. That's true. I think this give her the best chance that she could have now, and we'll have to wait and see how she does.
Thank you.
Okay.
You're
welcome. Okay. All right.
Thank you.
Does it taste good?
Jacob is sedated before he is taken to the OR waiting room.
Okay, that's half. Now maybe it doesn't. No.
Hello. You do the kisses. I'm going to take them and just surprise them. Let's see what's around the corner, etc., so we can get them in and before he kind of notices.
Okay.
All right. You hang on to that for me. There we are. No, it's all right. It's coming. There it is. There it is. Stop. We've got it. All right. Say we'll see you in a bit. Okay. All right, guys. Okay. We'll see you in a bit. There we go. Come and push the button on the door. Come and push the button on the door. Come on, see where we can go. No, it's all right. Push the button on the door. See where we can go. Push the button on the door.
But when you're born with the kind of problem that Jacob has, you don't have the luxury of having a pumping chamber to the lungs and a pumping chamber to the body. So you take the pumping chamber that's available, you make that go to the body, and then through the series of these 3 operations, you are able to have blood flow passively through the lungs. And you have to be old enough before you can finish that operation, and that's why we don't do it all in one stage, and that's why Jacob now, at 2 years, 2.5 years of age, is undergoing his 3rd operation. Okay to start? Let's coag on. 35, please.
Scar tissue from Jacob's previous surgeries makes opening his chest more risky.
You know, this is the 3rd time into his body, so there's a lot of scar around the heart, just like you make a scar in your skin when you cut your skin and it heals. Well, there's scar all around the heart. That raises the risk a little bit. He has this little thing in his chest where it points in a little bit, and you have to be careful when you open his chest that you don't get into the heart.
Jacob's heart could be stuck to the inside of his chest. A misstep could result in catastrophic bleeding.
And then you can tell your friends.
Doctors are ready to treat David's cut.
All right, I'm leaving.
Okay, so you're going to leave, and you're going to leave, and you're going to be with the big guy. Okay. Now, what we're going to do is let's have a look and see if it's okay. Oh, it looks as if it's working. So Dad did a good job. Okay.
Can I clean you off here, David? Just using some of this solution here. Tell me if this hurts at all, okay? Shouldn't hurt.
So we're making it really, really clean for you, okay?
Okay.
Okay.
That hurts.
That hurts a bit?
Yeah.
Okay. So who's going to guess how many staples you're going to get? Any guesses?
Dave?
I don't know.
What do you think? 3, 4?
Daddy said I don't know.
I figure you might have 3.
Jacob has been in surgery for 3 hours. The team is ready to insert the Gore-Tex tube that will reroute Jacob's blood to avoid his heart.
Now let's look at this and see if we're pretty happy with the size match. Pretty good.
A little bit more.
Scissor, scissor, let's just trim a touch more there. Looks pretty good like that. Okay, 5-0.
The rerouting of Jacob's circulation is complete, but surgeons will not close until cardiologists evaluate every aspect of his heart function.
Go to the left side. Let's look at the atrial septum.
Jacob's body will have to adapt to the reconstruction, or he will not survive. Jacob's doctors assess his echocardiogram.
Yeah, that's a lot better.
His heart is functioning well enough that he can be closed.
So we found exactly what we knew was there and did what we expected to do. So far things seem to be fine.
Good.
That's where we want to start.
Good.
His heart is happy right now. His blood pressure's good. Initially, he wasn't sure if he was going to like it or not, and once we kind of worked through a few things, and he's looks really good right now. So far, so good.
Really good.
He was bluer across the eyes last time, so.
The sats are higher now.
What are they?
What are they at?
90s, actually.
Wow.
Yeah. We've done the first set of lab work. I'm just waiting for it to come back.
Is he going to wake up?
You know what? We're going to base our lab work. We'll do the chest X-ray, see how things are going that way, and if everything's going well, then we'll plan to wean the ventilation overnight. But it's too early to really say. We have to keep an eye on this just a little bit there.
Jacob will remain in the critical care unit overnight. Doctors are ready to staple David's cut.
Actually, so what you want to make sure is I'll put the first one in.
Okay. Just to hold
And
it?
so you hold it like this. Okay, and I'll tell you when to say ouch. You ready? You ready? 1, 2, 3, ouch.
Ouch!
That was it. That was pretty good. You think I can give you 2 more ouches?
No.
No? No.
See, his primate goes on its own?
Well, you have to just press it a little bit, otherwise it'll come out and you lost one suture.
Okay.
All right, so I think you'll do fine with just maybe another one, but we'll tell you exactly, and you're going to push down on it fairly hard.
Really push down?
Yep. And
Okay, David? Okay, ready?
Say ouch. Say ouch,
Okay,
ouch,
1,
ouch,
2,
ouch.
3.
Ouch.
Excellent. Very
great.
good. One more, and you're out of here.
So it is 3.
All right. Yep.
Okay, David? One more time.
Okay,
Ready?
ready? 1, 2, 3. Ouch!
Oh!
That was it. So you can sit up and tell me how you're feeling. I don't want you to be dizzy or anything. Okay? Yep.
There you go. Okay. How you feeling?
Good.
Does your head still hurt?
I know.
Does it hurt?
Oh,
Does the staple hurt? You can't
a
feel
little bit.
Can you feel the staples?
Yeah.
Can you feel it? How many have you got?
3.
You know what time it is?
What?
It's past 11 o'clock. So I guess we should go home.
Yeah, we should.
Okay. Let's go home.
As long as his cut heals well, David's family doctor can remove his staples in 4 days. "13-year-old Edgar has been diagnosed with a lump in his lung.
When I first heard about it, I was pretty scared. I was afraid of the operation.
Doctors do not know if the lump is an infection or a tumor and have recommended that it be taken out.
Okay, Edgar. Go ahead.
Take
1,
a
2,
deep breath.
3.
Just a little poke, okay? All right, a little poke. Good. Good. Done.
Today, Edgar will undergo surgery to remove part of his lung along with the lump.
So you've got this lump in the middle lobe of your right lung, okay? And it's caused a couple of infections. It's been sitting there for a long time because it's been known about since about 2 years ago or something, right? It hasn't changed in size, so we don't really know what it is, but it's either some kind of infection or it's some kind of lump, and lumps can be benign or malignant. And the reason for removing it is, number one, so that we'll know for sure what it is, and number two, because it has caused infection a couple of times, and we don't want that to happen anymore. And it's obviously not going to go away because it's been there for this long.
Edgar is taken to the OR waiting room. One day after surgery, Jacob remains in the critical care unit.
I'm really happy with this course, though, for sure. And you know, going in, he had great numbers, but just the fact that he had trouble before, we weren't 100% sure of how well he was going to do.
He's probably a little bit more tired right now.
I'm sure he feels like he's been hit by a Mack truck.
Yeah.
I think we underestimate how bad it must feel. And the only thing over the next few days that we just have to see what he's going to do is the draining from these tubes. Sometimes the kids over the first 24, 48, and even 72 hours will start to pick up a draining. Even over the first week, we're just kind of watching.
3 surgical tubes drain fluid from Jacob's lungs. He will be carefully monitored for signs of accumulating fluid, which could result in heart failure. Edgar's lung surgery is minutes away.
So I read quite a bit about you. And otherwise healthy?
Yes.
Yeah. And you've never had an operation before?
No.
Operation. So never been put to sleep or general anesthetic or anything? Okay. Can I just quickly listen to your lungs? Take a nice deep breath. In out. Good. So whenever we're ready, Edgar. Just a mask, okay? Take some nice deep breaths.
Okay, so there's the...
An opening is made in Edgar's back to expose the lung.
So we don't usually need to make a big, huge incision. So we're going to remove this lump, and we may have to remove the whole middle lobe with it.
You want to see if he'll stand?
Sure. 5 days after surgery, Jacob is encouraged to move to keep his lungs clear. He continues to drain considerable amounts of fluid from his lungs.
Well, the middle one always has just a little tiny bit in it. As you can see, it's the red, so it's coming from the center somewhere.
It's around the heart.
The outside ones are filling up regularly, significant. I don't know what amount, but there's always liquid in there to drain whenever they go to drain, those 2 outside ones. So this one might come out today. We've heard that it might. And then the outside ones, they said it could be days, weeks, or even months. And they don't know until it stops. You're not happy. You're not happy. I know. You want to go back to your room?
Three weeks after her eye surgery, Alyssa returns for a checkup.
We first met.
Yeah.
Hi. Okay, just lift her off the blanket.
Hi again. Come on, just one more time.
And here I guess that because of the haze of the cornea, it will be difficult to see. It's not a pleasant examination to watch.
Okay, bunny. Okay, honey. Mom's got you.
Especially not to moms, not for moms.
We've been through a lot since she's been born. She's doing great. It's the main thing. Okay, good girl. So how's she doing?
So I can't see much of the retinas in both eyes, and so we have to follow her and to see. I hope that next week we would be able to see more. Yeah, to see more. Okay, to see more and to see good things. Okay.
Yeah. Okay. Thank you. Please.
Alyssa will return for weekly assessments. Doctors will not know if her retinas have been successfully repaired until the inflammation clears. Edgar has been in surgery for 3 hours. Doctors have exposed the lump in his lung.
Yeah? The lump?
See the little yeah.
Yeah. It's odd looking. Looks almost like adrenal tissue or something. I wonder if it's a carcinoid. Okay, here it is. It's not going to be big enough, but I just want to feel the...
Can I give you the knife?
So there's the lung. There's that yellowish stuff. And here's the lump right here. That's hard. This is all squishy stuff.
The lump will be sent to pathology for preliminary testing to determine if it is cancer.
Unblock the blocker. Right? Yep.
It's a lot of stress, you know, it's something unexpected. It's the back of your mind all the time, and you're thinking about it, you know. It can be, like, as doctors said, you know, about the nature of the lump. Could be benign, could be malignant, could be anything.
Edgar's father waits for news from the operating room. The pathology lab's preliminary report is ready.
Hello. Hey, Charles. What's that? Oh, my goodness. Yeah, okay. Great. We're all done. How are you doing?
Pretty good,
I heard
thanks.
you had a little nap. Just like Edgar. So we're done. We found the lump. It was in the middle lobe where we thought it was. We sent it off to the pathologist, and he's had a preliminary look under the microscope, and he's calling it something called a mucoepidermoid carcinoma, which is a kind of tumor, but it's got a very good outcome, especially if we can remove it all, which we did. You know, he can check the margins to make sure that we didn't leave any in, and he said we got the whole thing out. We have to wait for the final pathology to be 100% sure about the diagnosis, because sometimes the preliminary one isn't accurate, so we're not going to make any fast moves. But assuming that it is a mucoepidermoid carcinoma, I'm going to ask the oncologist to see him. Those are the cancer docs. But he will require follow-up.
Oh, yeah, absolutely.
We'll have to do scans and x-rays just to make sure that nothing's changed.
Yeah. 12 days after surgery, Jacob is no longer draining fluid from his lungs.
We're just living here and hanging out and quarantined to our room, so we're spelling each other off, Todd and I, so. Okay, let's go.
His last surgical tube can be removed.
Okay. Probably want to see outside too, eh?
No, you should be okay. The last one, it's all gonna go.
We've got this tube in his park there. Looks good. We'll take the bottle, that might help. For a minute or two. Want to have your bottle? It's okay.
Yum. Do you want some? That's a boy.
Okay. Okay. Okay, you want to just put those out? Have a drink?
There, we're done, Jacob. That's the last bad one.
She's wondering if there's still something else going to happen. They haven't left the room yet.
That's hopefully the last bad thing we have to do to him.
It has been 2 months since Alyssa's eye surgery. Today, her doctor will find out if her retinas have reattached.
Freezing drops in the eye.
Okay, buddy. Mom's got you. Good girl. She says, I'm so used to this now. There we go. Okay, it's time. Okay, Mom's got you. That's okay. She spits it out anyway when you come in. Okay, honey. Okay, stay still. There we go. Okay. Shh. He's just helping you. He's going to help you. He's going to help you see Mommy and Daddy. Yeah. Come on. Okay. Okay. Oh, good girl. You did good. You did good. Mom forgot to tell you this was the day you had to have that done. No. You okay? Oh, Daddy's up. I know, you're hungry. Shh.
The retina is not reattached. I'm not sure more surgery is going to be helpful. The reason I'm saying that is the retina has come forward so much that to try to force it back is going to be very difficult. What may have happened is that the scar tissues or the retina itself has slowly pulled itself forward and being right up to the front. That's why in the right eye you can see that there's this kind of grayish area, and I think that's what you're looking at is the retina that has come all the way out. So it looks like the retina is completely detached, and once that happens, it's very hard to fix.
One day after the removal of his lung tumor, Edgar remains in a constant observation room.
How are you? How are you feeling this morning?
Good.
A lot of pain or not too bad?
Not too bad.
Did anybody talk to you yet about what that lump was? We don't have a final answer, but it looked like some kind of tumor, but the kind that goes away once we take it out and has a very, very small chance of coming back. So it's good news. Could have been something bad, but it looks like it's something that's completely curable by removing it all. But we won't have a final answer from the pathologist for another day or two.
What groceries did you get?
2 weeks after heart surgery, Jacob is ready to be discharged.
Banana! Like bananas?
How are you doing?
Good.
Getting excited to leave this place?
Yes.
Yeah. Banana. Yay, how are you doing? Our game plan then is to see him back on Friday, and he'll kind of have an early post-op clinic, making sure with an x-ray, he hasn't reaccumulated any fluid in his lungs, making sure his heart size is okay, and making sure he's doing okay. We're really happy with him. I mean, he does it beautifully. Okay, so we'll see you on Friday.
Okay, good, guys. Thank you. Yeah, say bye-bye. Are you having some tea? Are you having some tea? After 2 weeks, he's going to be released, and that's a very good thing, considering that we heard that it could take weeks to months for the final drain. So we're just ecstatic about being able to go today.
That's funny.
Jacob will return in 3 days for an x-ray to be sure additional fluid has not accumulated around his lungs.
Bernie, got a painted there.
What's your pain like when you're walking?
3.
That's 3? Good.
2 days after surgery, Edgar begins walking to help keep his lung clear.
You're really good.
It's been 2 days since the operation was done. It was Monday morning. It's recovering pretty well. We're happy. We haven't heard from the pathologist yet, but we're hoping for the best.
Hi.
Good day.
How are you?
Fine, thank you.
Having a good day today?
Yep.
Excellent.
2 walks.
Good. Pain's better?
A bit.
What's bugging you the most?
Back.
Your back?
Yeah.
So you're well on the way. You eating or just drinking?
I started eating too.
Good. All right. So really the 3 things you need to be able to get home are chest tube out, off your morphine, and eating. And you'll be one of those down, actually 2 of those down in the morning, so it'll just be a matter of getting off the morphine, and then you'll be done.
4 days after Edgar's lung tumor surgery, he is ready for discharge.
Going home. Finally, yeah.
We're closing the first chapter, I guess, with all the hopes for the best, for the full recovery. We're gonna see Dr. Langer in a week and a half.
Edgar will have to wait until his follow-up appointment or the final pathology report on his tumor. 3 days after discharge, Jacob is x-rayed to see if more fluid has accumulated around his lungs.
Okay, you're great. Hey, big guy.
He's just looking
Checking
wonderful.
things out. His x-ray looks perfect.
Excellent.
So nothing in his lungs, his heart's the same size, nothing new. That's excellent. I'm
Good.
assuming that's going to be where he's at. Can I listen to you? Let's take a listen. Good boy. Nothing. Okay. Sounds great. No murmurs at all. His lungs sound clear. And he looks fantastic. I'm anticipating things should be really smooth at this point. We'll see him back in a year.
Wonderful.
Yeah.
Jacob has had a remarkable recovery from his third open heart surgery. Although his heart will never be normal, Jacob is healthy, and doctors are optimistic that he will not need another surgery for many years.
How many duckies? You? Alyssa. Alyssa. Is it you? Alyssa.
It has been a year and a half since Alyssa's unsuccessful eye surgery.
She's used to it. You want to go down and play with some toys now? I said, Mom, what do you think of her? Like, after being here a couple weeks, she said, I figured I would be crying the whole first week. She said, I prepared myself to have a bad week. And she said she's amazing. She just couldn't believe it. Like, she said, I thought I was going to feel so sorry for her. But she said, I don't at all, because we're always running after her. She's just like any other normal child. Probably a little worse for being hyper and going around, but she's amazing. Keeps us going, that's for sure. Mama. Go in the kitchen.
Mama.
What?
Mama.
What? I guess we take our strength from her, mostly. And at first I know for me, I was really afraid. But we had a lot of prayer. Everybody prayed for her and for us.
Mama.
What?
Mama.
Although Alyssa is blind, she is a happy, healthy girl and a treasure to her family.
Where's Mom? Where's Mom? Where's my mom?
2 weeks after his surgery, Edgar returns for a final pathology report on his lung tumor.
Hello. How are you doing?
Good morning.
Nice to see you. Any pain?
Just a little bit sometimes.
That's good. We got the final pathology, and it is what we thought it was. It's a mucoepidermoid carcinoma, which is a form of cancer, but the good news is it's a very low-grade type of tumor, and if it's completely removed, then you don't have to use any other treatment for it. And the pathology says that we got all of it out. The margins of the specimen did not have any tumor in them, so we were completely around it. And I don't think we need to do anything further other than follow you fairly closely. So that's it.
Thank you.
See you later. You're very welcome. You did great.
Thanks.
4 months after surgery, Edgar has fully recovered.
I feel good. It's getting better, and I can play normally now.
Edgar will require follow-up, but doctors are hopeful that his lung tumor will not return.